safety. The edges of the electrodes must never touch each other. They cannot physically touch each other. Otherwise, the patient will receive a burn in 5 seconds. It'll be warm, hot, youch. So 1 inch is the minimum spacing on the back. 1/2 inch is the minimum spacing on the extremities. Having said that, there's software built into both our Biowave Pro and Biowave Home devices that prevents patients from getting a burn. The software calculates power density in real time at the surface of both electrodes. Above a certain power density, you burn the skin. Right before the device gets to that unsafe level for that particular patient's skin impedance, it will reduce the intensity by about 3 percentage points in real time. Basically, the system is preventing the patient from going up too high in intensity and burning themselves. While that's happening, the plus button on the face of the device is disabled, and it prevents the patient from going higher while it's throttling that signal back. So even in a clinic setting, if the patient is controlling the device, or the patient has a Biowave home unit at home controlling the device, they can't burn themselves. It's part of our patented signal technology. Contraindications. Electrodes must be placed on intact skin. You cannot place an electrode over very rashy skin, over wounds, over incisions that have not yet healed. You can treat, for example, immediately post-surgery, say morning following surgery, and the electrode can be right next to an incision, but it can't be over the incision until it's healed. Once there's scar tissue, you can treat directly over scar tissue. Electrodes cannot be placed on top of the head, across the temples, or on the front or side of the neck. Electrodes cannot be placed over the heart, on the anterior of the thorax. You can treat on the left side of the rib cage. You can treat thoracically on the back. Any type of orthopedic hardware inside the body is totally fine. It's not a contraindication. So plates, screws, pins, clips, anchors, any total joints, even shrapnel, any type of metal hardware inside the body is not a contraindication. The other contraindications are patients prone to seizure, even though there's no negative data, and also electrically implanted devices like defibrillators or pacemakers. Again, there's no negative data, but those are contraindicated. You can't use Biowave if you have one of those devices. Implanted spinal cord stimulators, implanted peripheral nerve stimulators are fine. Typically there's a remote control. You can turn them off, which you need to turn them off first, and then you can treat with Biowave. Implanted pain pumps are not contraindicated. Pregnancy is not a contraindication. In fact, we have good results treating back and hip pain in pregnant patients. Pregnancy is just considered a warning. Also, cancer patients it's not a contraindication, it's just considered a warning. We have some anecdotal data that shows patients with pain resulting from cancer can also get good pain relief.